information on prevention, tools for a healthy lifestyle. Make little changes to be the best you. It's all here. A podcast empowering, informing, and motivating Bermuda to live well. Bermuda Health-Abets. Everything from A to Z on healthy living. Brought to you by the Health Promotion and Wellness Office of the Department of Health in collaboration with local health partners.
Welcome to an episode of Bermuda Health-Abets, a podcast where we discuss everything from A to Z on healthy living with the mission of empowering, informing, and motivating Bermuda residents. Hi, I'm your host today, Alison Otterbridge, and I am a public health nutritionist. Today's guest is Azari Williams, the lead for the Educational Department of Bermuda Cancer and Health Center. Azari is going to share with us on the topic of cervical cancer as we observe Cervical Cancer Health Awareness Month. Welcome, Azari.
Thank you.
Before we get on to our topic, can you share a little bit about your background and your role with the Bermuda Cancer and Health Center?
So I've been at Bermuda Cancer and Health Center for 10 and a half years. I started off as the SunSmart coordinator part-time because I was still kind of juggling homeschooling with 4 children. And then I started as the event coordinator in 2015 and then moved on to event and program manager in 2016. So I've managed all the center's fundraising events, including Relay for Life, all of our education programs. We have approximately 5. And then I also was the volunteer manager. And right now I am solely responsible for education and all the programs.
Wow. That sounds like a lot. Well, you've had a good progression.
Yes.
And now you're in the educational standpoint. So when we're talking about Cervical Health Awareness Month, I know you said it was observed in January, correct? Is there a specific day that it's
the entire month of January globally is considered as Cervical Cancer Awareness Month. Yeah.
So what are the Bermuda stats as it pertains to cervical cancer? How do we compare globally?
So thankfully, Bermuda is relatively low. According to the Bermuda National Tumor Registry, we are 11th. Cervical is the 11th cancer diagnosed locally, which isn't so bad. I believe it was in the 2022 stat report from the Tumor Registry. Roughly 4 individuals were diagnosed, and that's kind of low in comparison to the global stat, which is cervical cancer is the 4th cancer diagnosed globally. And it's primarily in third world countries that are underdeveloped. They don't have access to optimal health care, screening, and all of that. And the reason why in the Western world, primarily Bermuda and the Americas, is because we have that access to screening. Roughly, I want to say 78% decrease in cervical cancer in the Western world because of pap smear screening. That's huge.
Wow.
Yeah.
So if you're talking about risk factors, what should we look out for? What types of things would someone who maybe hasn't had their pap smear look out for?
Well, definitely, I mean, before we get into signs and symptoms, risk factors, like if someone suffers from endometriosis, they have a lot of, issues with their feminine organs, where they get cysts a lot of the times. Those things can lead down the road to cancer. So it's important for women to go for their regular pap screening. And then also there are guidelines on that as well. Not everybody's meant to go every single year. It really depends. But HPV is one of the leading causes of cervical cancer, and HPV is the human papillomavirus. So it's kind of tricky because, the whole vaccine topic is very controversial. And I get it. I'm a parent as well. But it's about making informed decisions. The HPV vaccine can reduce your risk for cervical cancer in females. It can also reduce males' risk for penile cancer, throat cancer, oral cancers. There are so many cancers that come from the HPV or the human papillomavirus. But it's definitely critical that people have conversations with their doctors, because the recommended age for vaccination is 11 to 12, and it goes up until age 29 to be vaccinated with the HPV vaccine.
As young as 11 years
11,
old?
yeah.
Wow.
And in the third world countries, they're pushing for 9.
Wow.
Because you have so many incidents of rape with, younger children in the third world countries. It's primarily when children or young people tend to become sexually active, and you're seeing it happen more and more at a younger age. However, in those third world countries, they say 9 because of the high incidence of rape and incest in those third world countries.
And you said the 29 is the upper end of that range.
Yeah, so they really go up, and you can get vaccinated up until you're 29. But the vaccine, I must stress, the vaccine only protects against 2 specific HPVs. So there are so many HPVs out there. The virus has multiple strains, but the vaccine is specifically covering the 2, and those 2 are primarily involved with cervical cancer. So it's weird, because when you think cervical cancer, you're like, okay, that's a female cancer. It's nothing to do with males. However, males are carriers of the HPV, so they can infect more and more females with HPV. Typically, HPV is something that people get rid of on their own. Almost every single person in the world has come in contact with HPV at some point. But generally, it kind of dissipates and goes away on its own. But if it's a severe case, it can lead to cervical cancer.
So the recommendation for people that are sexually active from ages 11 to 29, male and female, correct, is to get the vaccination. What happens to those that after 29?
Well, after 29...
What if he didn't get it?
Right.
What happens after?
So again, this comes down to the screening. So risk factors are, if you're sexually active, you have any kind of cervical or feminine female organ issues with the cysts and fibro, they may be fibrocystic. It's just so many things that could be occurring in women that they need to be going for regular checkups. Not getting screened is putting yourself at risk. And then when we're looking at down the road, if you're over 29, again, you should be getting regular screenings. So starting screening for Pap smear starts at age 21. That's the World Health Organization's recommendation globally. That's what women should be doing. And then once you reach a certain age, usually around 29, they're saying every 5 years. So 29 to 65, it's every 5 years. 21 to 29, it's every 3 years. Some doctors do every single year, and that's if you're a high-risk person. If, you've been diagnosed with HPV before, it may have gone away, but they want to monitor you again. So starting at age 29, the Pap smear is given in conjunction with HPV DNA test. So again, this is all taken when they swab you with your Pap.
Right.
And, it's sent to the lab. And if you're coming back positive for HPV after the age of 29, of course, because you're above age for vaccination, that's when the doctors will surveil you and monitor you and have you come in more often, sometimes every 6 months, for a Pap and an HPV DNA test.
Okay.
Yeah.
That's interesting.
Yeah.
So with regards to the symptoms, we already talked about the risk factor. So now we're talking about moving into the potential for someone to be at risk.
Yes.
What symptoms do women look they look out for as it pertains to something that could potentially be cancer?
Well, it's so, again, this is another tricky one, because so many cancers have similar symptoms. So many symptoms that could be cancer symptoms are not. It could be something else that's not life-threatening, that's not as serious as cancer. But again, this is where women have to be their own best advocates, know their body, pay attention to the changes. So, if you're spotting and you have blood, it's not your cycle, you're not on your period, and it's not normal, you're not pregnant, you're not at risk for having a miscarriage if you are pregnant. When you're seeing blood and you know that you shouldn't have blood, whether you're spotting, you could have light bleeding between your periods, those are signs and symptoms, especially for women who are of reproductive age, not necessarily talking about women who have, gone through menopause and, they're much older. Also, the bleeding after intercourse, if that's happening, that's a sign. Increased vaginal discharge. Sometimes there's a bad smell coming from that discharge. Those are definitely signs. And this is at the early stages. When it becomes more advanced, the symptoms are slightly different. So that's when you'll see where you may have a persistent back pain, leg pains where you wouldn't think, pelvic pains, just depending on how advanced the cancer is. And then it's hitting nerves, it's into the lymphatic system, your lymph nodes. So then you have all sorts of symptoms that could start. Definitely weight loss, fatigue, loss of appetite, having vaginal discomfort is very common for advanced stages. And then the legs swelling, and then, having pain and swelling in both of your legs. Those are signs, and people may just put it off as I've walked too much, I am retaining water, retaining fluids, but you just never know. It's important that if you do experience any of these signs and symptoms, have a conversation with your doctor, because that's not your normal. This is outside of your normal. So it's important for people to be aware and go and get checked, have those conversations.
So those, for those, even with, I know the pap smear, you said it depends on how often.
Yeah.
So I'm even confused as to how often. No, because I think the regulations have changed over the years.
They
from
have.
Every year
it used
to
to be
every 2
every year.
years.
And it really depends on your doctor.
Yeah. So can you give a bit of, are you more aware of like the protocol as let's say someone that's uninsured?
Yeah.
How often now? Maybe I don't have a private practitioner, gynecologist.
Right.
Maybe I'm going to the clinic. How often would I
So
do that?
different doctors recommend different schedules
Okay.
for your screenings. But World Health Organization definitely, they recommend age 21, you do the pelvic exam and a pap test. And then between 21 and 29, you have the pap test every 3 years.
Every 3 years. Okay.
Yes. And then that's without HPV testing unless there's an abnormal pap result. Then women between the ages of 30 and 65, because 65 is usually when things start leveling off, that's when they're recommending pap test and HPV test every 5 years. Once you reach 65 and you have had all negatives, you don't have any risk factors, the doctor's comfortable will advise you to not continue once you've reached the age of 65 and you've had negatives. You haven't had any issues. The doctor will say you don't need a PAP anymore. So
Interesting.
yeah.
Okay.
And it's similar. So
the risk that goes down after 65 significantly.
Yeah, because cervical cancer tends to be more common in women in their mid-30s to 40s. You don't typically see cervical cancer in women in their 50s, 60s. Whereas it's slightly different with breast cancer. Breast cancer, the older you get, the higher your risk. So women who are in their 50s and 60s have that 1 in 8 chance. Whereas cervical cancer, yes, it's the 4th most commonly diagnosed cancer globally. Thankfully in Bermuda, women are on it. They're getting screened. They're getting their pap test.
Awesome.
So we are not, yes, we have those few unfortunate cases diagnosed on island, but we have not had significant numbers compared to the other side of the world where there's underdeveloped nations do not have access to optimal health care. They don't have screenings. I mean, sometimes there is a documentary on HPV and cervical cancer. There are actually two. I've lost the name of it. One is Lady Ganga, where it's a journey. You're following a woman who's in her 40s, has 2 young children. She's diagnosed with cervical cancer because she skipped going for her PAP 2 years in a row. Didn't know her risk factors, didn't know the importance of getting an annual PAP at the time. That was when it was recommended annually. And she had missed 2 years. But, you know, sometimes when you're having a sexually active life, going for regular PAPs, that's when somebody might need to go every single year.
Correct.
If you're sexually active and you may have multiple partners. Like, those are serious risk factors. But, you know, it's following this lady on her journey of, you know, her saying she wished she would have gotten, she had no idea the importance of a PAP, which is just a simple test that you go in to get screened, to get checked, to see if it's anything abnormal. And if it is, when it's caught early, there are things doctors can do.
Yeah.
But if it's late stage, usually that means it's advanced. So stage 4 is the highest stage of cancer. And if you are diagnosed with stage 4 cervical cancer, which tends to be a lot of the cases, that means it's spread into your lymph nodes, it's spread to other organs. And there's nothing doctors can do other than make you comfortable. So ladies need to get ahead of it. So far, so good for Bermuda. It seems like we're doing pretty well. It's unfortunate we have those few cases that do pop up. But considering that it's the 11th most commonly diagnosed here in Bermuda, it says a lot that we're doing something right in comparison to it being the 4th globally.
Absolutely.
Yeah.
Why do you think that the regulations for pap smears have gone from annually to every 3 years? Is it because of the
I think
low
it's
rates?
because the rates are going down, especially in the Western world. Those recommendations, even though it's coming from the World Health Organization and it's recommended as a general recommendation, in those third world countries, they may not be able to afford to wait 3 years before they go and get a PAP.
Especially because you're saying that person that missed 2 years.
Exactly.
So you're saying, so I, just based off not in summary, but if you have higher risk factors, screen more frequently.
Yes.
Is that the recommendation?
And I feel this is what I mean when I'm referring to it depends on the doctor and it depends on the case. So as much as we really should be practicing more individualized healthcare and the whole person healthcare, we don't, because, you know, a lot of the times it's not economical. But we also have to avoid blanket prescribing things in a blanket fashion or in a general fashion. So you and I are 2 different people, 2 different sets of genetics. We may have, we're both females, but we may have completely different risk factors based on our genetics. If we have a family history, that's a risk factor. If you have a family history of someone who's had breast cancer and cervical cancer, you could be at risk because female cancers sometimes are connected.
Right.
So when we're looking at each individual case, the doctor has to look at the individual and what their makeup is. What is their health history? So if this person has been screened once or twice before, they've been positive for HPV, the doctor's going to probably say, you need to come in every year for a screening, as opposed to 3 years. But again, it depends on how much the doctors are keeping on top of what the new recommendations are. Some doctors will change up and go with those recommendations. Some may not. They want to be as vigilant and as diligent as possible, and they'll stay with that annual screening schedule for that particular patient. So it really depends on what your health history is, who your doctor is, and you know, how vigilant are they, what are their best practices. So it really depends.
Complete sense. So if we're talking about the extreme, what treatment options do women or anyone have in Bermuda? Is it something where you have to go away? If you've been diagnosed, what are the options? I know you said that stage 4 is more palliative, make you comfortable. What about the other stages? What options do they have?
So there is surgery where they have to remove a portion of the cervix or remove the whole cervix. Sometimes they have to remove a portion of the uterus. It really depends. The documentary, I think it's Somebody We Love, the HPV epidemic. I don't want to say the wrong title, but Cheryl Starolakis, she was the producer for the film, and they brought it here, and Bermuda Cancer and Health Center partnered with Department of Health, and we were promoting the film and had showings, and it was all in the schools where they all had, free DVDs that were given to them to educate them on the importance of knowing what HPV is, the human papillomavirus, how it impacts you based on your sexual activity. And one of the ladies in that particular film, she was or is an African American, and it completely felt like it ruined her life, but she turned it around and became an advocate. But she had to have her entire cervix removed, her uterus removed. Wow. And fortunately she had a child, I believe. And then another lady in the film was of Spanish descent, and she was a Latina, and her marriage was destroyed. Her husband blamed her, basically because people think of cervical cancer because it's primarily caused by HPV, just assuming that, she's fooling around. But it could have been him that she contracted HPV from, and he could have caused the cervical cancer to develop in her. Men are carriers of HPV, just like a female is. Men can pass on that HPV, which can lead to a cervical cancer diagnosis in women, but men can also be diagnosed with penile cancer, the throat and mouth cancers as well. Women can have the throat and mouth cancers, especially if you're having oral sex. Correct. You pick up the HPV that way. So it's definitely a journey for women who go through this process. If it's surgery, it's also chemotherapy, radiation therapy, which Bermuda Cancer and Health Center has radiation therapy that we offer. We've had cervical cancer patients receive radiation there.
You can have treatment on island.
Yes,
you don't necessarily have to go away.
Depending on how severe and specialized the case is. So primarily Bermuda Cancer and Health Center's radiation unit can cater to over 95% of cancer cases that are diagnosed, except for specialized cases where, it may require different types of radiation. It could be targeted. Sometimes, so we use the beam, Linac beam, whereas, other outside of Bermuda, they have other options for radiation therapy, and the types that may, depending on the severity of someone's diagnosis, may require them to go overseas. Wow. But for now, generally speaking, with cervical cancer, those few cases we've had diagnosed recently on island, they've been able to have radiation or chemo at the hospital.
Awesome.
So the options are there.
So what does Bermuda Cancer and Health have planned for the month of January? Do you guys have any initiatives happening or?
Not really. I mean, we used to have a lot of, when we were doing the whole collaboration with Department of Health, we used to do outreach, and we had the film screening, a few years back. That was pre-COVID. But now we're doing the podcast with you guys. We do lots of social media posting, especially because we want to target those younger people because they're the ones that are at a higher risk. So social media is really where you're going to get that blitz for
the
cervical cancer.
Information.
So folks can just check out our social media pages. We have Instagram, Facebook, and we'll have definitely key points that we'll reiterate that were discussed here. We're going to have those all over social media.
Awesome.
Yeah.
Awesome. So in summary, we want to make sure that women and men are being screened to make sure that the HPV virus isn't active or causing further issues. We want to make sure that women and men are educated and know the risk factors. They know what symptoms they should look out for as it pertains to how often they should be screened, how often they should check in. We want to also make sure our rates remain low.
Yes, exactly.
So I know that from a treatment standpoint, we could also stay here. So I think that's also something that women and men will,
Such a relief.
you know, is a relief, not having to worry about going off island in the event that that's necessary. But I think the moral of the story today is get screened.
Get screened.
Make
Get
sure
screened.
you get screened.
Yes.
So today we've been having a conversation with our guest, Ezri Williams, the lead of the education department at the Bermuda Cancer and Health Center. And we've been discussing Cervical Cancer Awareness Month, which is the month of January. We've pretty much summarized everything we talked about today. Is there any other things that you want to leave with our listening audience?
I think we covered a lot. I really would just like to encourage people to be their own best advocate. Know what your normal is for your body versus what abnormal is. And the minute you notice something abnormal, question it, go get it checked. Even, I mean, we're talking about cervical cancer and PAP screenings and HPV testing, but it's any kind of ailment, anything that is different and out of the norm, you really shouldn't leave it. So many people leave things and it ends up being worse because they've left it so long and it's difficult to treat or fix.
Yeah.
So go get yourselves checked, screened, regular checkups every year. Be your own best advocate and take care of yourself.
Awesome. If any of our listening audience had any questions, is there any way to contact you guys? Is it through social media or directly?
Well, social media definitely, but our website, we have an info section where they can type up an email. We have information as well and links to resources so that if they want to just do their own research, we link people to valuable resources with our partners from other cancer organizations around the world. And they can always email us at info@chc.bm.
info@chc.bm. All right. So we want to thank you for listening to our listening audience. Thank you for listening. Thank you, Ezri, for coming and taking time out of your busy day. I know that you guys, in addition to getting ready for the holiday season, a lot of ends and odds have to be tied up. So thank you for coming on the Health-Abets podcast. We invite the listening audience to leave feedback in the comments of the comment sections of the Department of Health YouTube page. To our listening audience, please keep an eye out on this spot for the next episode of the Bermuda Health-Abets. Follow us on Facebook and on YouTube, Department of Health Bermuda.
You have been listening to Bermuda Health-Abets. Please note, anything you heard on this podcast is not a substitute for visiting your healthcare provider. If you have a topic or want a question answered, please contact the Health Promotion and Wellness Office of the Department of Health by emailing healthpromotion@gov.bm or by calling 278-4900. Be sure to listen out for the next episode of Bermuda Health-Abets.